All right, we're going to talk about breast augmentation. So, what would an implant do and why should you go for it? So, implants usually replace volume. Some people have deficiency in volume, usually around the upper pole, and they want the breast to be fuller in that area. And an implant can help you achieve that. There are other ways of doing that, including like fat grafting, but an implant can give you the most dramatic change that you, especially if you want to go a few cup sizes bigger. So, how do we determine your implant size? Usually, the implant size is determined by your frame. So, we measure your breast width and go usually by that, and how bigger you want to get, or how many cup sizes you want to get bigger. And then we will talk about the profile of the implant. So usually if you want more projection, we go for a more projected implant versus if you want a more, let's say, upper breast fullness, then we can go with a lower profile implant. I can show you a few implants we've got here. So this implant is actually a very projected and a high profile implant. And usually if you want to be more projected, then we go for that one. Well, if you want to go for more fullness at the upper pole of your breast, then you want something a little wider that would actually reach the upper pole and would show as more fullness over there. The other aspect of breast augmentation that we usually discuss is where the incision is made. Usually there are multiple ways of doing a breast implant. You can go around the areola, which is usually kind of a hidden incision. You can still kind of notice it if you look closely, but for the most part, for someone who doesn't know that you had a breast augmentation, wouldn't notice it. Other incision sites include going through the armpit or going underneath the breast fold. Which incision do I prefer? I usually go for underneath the breast fold for multiple reasons. So studies have shown that going in the breast fold, since you're going into technically a cleaner area, there's less risks of infection or for capsular contracture. I'll touch base on the capsular contracture a little bit, which is essentially every body forms a protective layer made of scar around any foreign object. So everybody will have, whoever gets an implant will get a capsule around their implant. When does it cause trouble is when that capsule contracts, it becomes thicker and it contracts on top of that implant and causes pain or disruption of the shape of the breast. There are multiple theories on it, but the most well-known theory is that the introduction of certain kinds of bacteria into that pocket when you form it, or later down the line through like the ducts or such, can cause that area to have a bigger reaction and essentially contract on it. And if that happens, then you might need a revision down the line. So going through the breast fold can actually decrease the chances of having capsular contracture, and that's usually my preferred method. In addition, it's a well-hidden scar. It's underneath the breast fold. Unless you're looking for it, you usually don't notice it. Plus, it gives the surgeon a better view of the pocket and helps me control that area a little better. So the other question is, where do we place the breast implant? So there are there's a couple of ways of placing a breast implant, whether placing it on top of the muscle, underneath the fascia of the muscle, or underneath the muscle itself. Which one do I prefer? Kind of depends on the patient. So we come up with a bespoke plan for you. So if you don't have much tissue on top of your muscle, I usually don't like placing the implant on top of the muscle, because in that case, the implant will show down the line. If there's any folding in it, it will show as rippling on top of on the skin. And in general, it's also been associated with a slightly higher risk of having capsular contracture since you're closer to the ducts, and those can introduce that kind of bacteria to that pocket and eventually can cause capsular contracture. Placing it underneath the muscle has a lot of advantages. So it gives you a natural slope to the breast. So you don't actually see a lot of the upper margin of the implant, which usually gives people the fake look. If you're going for the fake look, then we can always place it on top of the muscle. But if you want a more natural look to it, then underneath the muscle can give you a better slope to it and a more natural breast shape. In addition to that, lower risks of capsular contracture. First of all, it's away from the ducts because you have a thick muscle on top of it. In addition to having the movement of the muscle, kind of breaks down those scars and decreases the chances of having capsular contracture. What are the side effects of putting it underneath the muscle? So usually if the muscle is strong and you kind of work out a lot, you do a lot of weightlifting, then you can get what we call animation deformity, where the breast itself moves with the movement of the muscle. That's not very common, but for people who do a lot of weightlifting and training, that can be something that can happen. In addition to that, with time, sometimes the muscle can push the implant a little laterally where there's no muscle and have some lateralization of that implant. Doesn't happen much, but if it does happen, that can be corrected with the revision of the surgery down the line. The other layer that you can place it under is the fascia, but it's usually a little harder to kind of completely remove the fascia off the muscle. And for the most part, it might have a lot of holes in it that it essentially ends up being like having it on top of the muscle, as in like a subglandular plane. I don't usually go for it, but it is an option, and we can discuss it if you're interested in it. All right. The other thing that we should also discuss is what implant type you want to go for. So all implants have a shell that's made out of silicone. So no matter which implant type you choose, there is an element of silicone that will be introduced. So even saline implants, the shell is made out of silicone. What are the benefits of having a saline implant? So a saline implant is essentially a silicone shell that's filled out with essentially saline. So why do we use that in certain people? Some people just want less silicone in their body and they prefer to go for the saline implant. So it's an option. The other thing is, if a saline implant ruptures, you would know that immediately. The whole breast size will kind of drop pretty quickly, and you'll know that. Versus if it's a silicone implant, then some people might have ruptures that they won't notice unless they get some imaging done and they get either an MRI or an ultrasound that shows that. So just the fact that you would notice it quicker might make people want to have that done. But what are the things that you don't like about a saline, wouldn't like about a saline implant? I would say it's usually heavier than a silicone implant. So sometimes it weighs down the breast and might lead to sagging down the line. Just having something heavier in there for a long period of time can affect the breast on the long run. In addition to that, it doesn't feel as natural as a silicone implant does. Silicone tends to have a more natural feel to it when you touch it and push on it. So my preference, if you're going for texture, is to go for a silicone implant. And if you're just worried about silicone and just want to go for a saline implant, that's also an option. Just be mindful that the shell is going to be made out of silicone. When it comes to silicone implants, you have multiple profiles that you can go for. It feels a little more natural. The newer generations of silicone implants are made out of what we call gummy bear kind of silicone, which doesn't leak as much as the older silicone. The older silicone used to have more of a more oil consistency, so when it ruptures, it tended to spread. But the newer ones are more of a gummy bear kind of consistency. So even if you end up with a rupture, it doesn't kind of spread as much. You do have to kind of monitor every now and then just to make sure that there's no rupture. But for the most part, they're much safer than they used to be. In addition to, you can control the cohesiveness of the silicone, so you can control how it feels. So some people might want to have a more cohesive, harder kind of implant. Others might want to go for a little softer implant. It also kind of depends on what is the purpose we're using it for. So sometimes when you go for people with like less tissue there, thinner skin, thinner glandular tissue, or people with reconstruction, I might go for a more cohesive implant that would hold its shape so it wouldn't have as much rippling and such. But we can always discuss those when we meet and go over which one is best for you. Whatever your preferences are and whatever your needs are, we're always happy to see you in a consult and discuss all those issues and tailor a plan to your needs.